Welcome to Brevard Public Schools. In this presentation, we'll talk about the benefits available to benefit-eligible employees at BPS. The BPS Benefits Program offers a variety of benefits from which employees can choose to customize coverage that's best for themselves and their families. This presentation will be a high-level overview of the program, but there's a wealth of detailed information within the employee benefit pages available on the BPS district website. Included in the benefit pages are two e-versions of our Employee Benefits Guide. There's an interactive flip book and one in PDF format that can be printed. Shortly after your start date, you'll be sent an email from a member of the benefits team which will contain customized information based on your date of hire. Please be sure to keep an eye out for this email. Information on this slide is especially important to you since the enrollment window for benefits requires prompt attention. You'll have 9 days after your hire date to enroll for benefits, and those benefits go into effect on the 14th day following your hire date. The email that you'll receive from the benefits team will indicate your specific enrollment deadline. Again, please be vigilant for this email as you don't want to miss your chance to enroll for benefits. Depending on what you'll elect, within the online enrollment process, there may be a couple of forms and/or affidavits which need to be completed. Please be sure to fill them out because failure to do so will lead to either loss of dependent coverage or a surcharge being added to the cost of your chosen benefits. If you'll be enrolling a spouse and/or children to your coverage, you'll be required to provide proof of their eligibility. For a spouse, that's a marriage certificate. For children, it's a birth certificate or adoption paperwork. This documentation must be sent to the benefits office by your benefits effective date and can be submitted via email or securely uploaded to your benefit portal account. Failure to provide the documents will result in loss of dependent coverage. It's important to know that the Employee Benefits Program runs on a calendar year, that is, from January 1st through December 31st, which is different from the school year. Why it's important to know this is because new employees will enroll for benefits twice in their first year. And depending on the hire date, the second enrollment could come just a month or two after the first enrollment. As a new employee, your first enrollment is for coverage to December 31st of the year in which you're hired. The second enrollment will be for benefits that are effective on January 1st of the year following your hire date. Once you've made your benefit elections, they generally cannot be changed. The only exception is if you experience what's called a qualifying event, which includes things like marriage or divorce, birth or adoption of a child, death, or your spouse or child gains or loses other coverage. To make a benefit change due to a qualifying event, you must notify the benefits office within 30 days of that event. If you miss the 30-day window, you'll have to wait until BPS's annual enrollment or experience another qualifying event. Let's now talk about medical coverage. BPS offers two PPO medical plans to choose from, Gold and Silver. Regarding the Gold plan, this plan is a traditional in and out of network PPO plan where using in-network providers will be the most cost-effective approach to healthcare. In-network providers are those who are contracted by Cigna to be part of their network. However, if you visit a provider that's not contracted with Cigna, you will still have coverage for those services, but at the higher out-of-network costs as shown. Additionally, regarding in-network providers, note that for primary care and specialist office visits, there's a copay differential. To pay the lower office visit copay, try to use physicians who have the Tier 1 provider logo showing in Cigna's online provider directory. Regarding the Silver plan, this plan replaces the traditional PPO in and out-of-network plan design with pricing schedules and assign specific provider groups to each pricing schedule. Though it's no longer an in and out of network plan, you can still use both sides of the plan as you wish, simply paying the noted schedule costs for the type of provider you use. The lower Schedule 1 pricing is limited to parish and steward hospital systems and their affiliated providers, plus independent physicians in Brevard County and Cigna's ancillary providers, for example, labs and outpatient facilities. Except for emergencies, coverage outside of these designated provider systems will be subject to the higher Schedule II pricing. The higher Schedule II pricing applies to Health First providers, Cigna network providers outside of Brevard County, including those in other states, and to non-network providers. As mentioned, you can use both sides of the plan as you wish. For example, if one week you see a parish physician for an office visit, Schedule 1, you'd pay a $30 copay, and that's that. You would not have to first meet the deductible. If a couple of weeks later you wish to see a Health First physician for an office visit, Schedule 2, you'd need to pay the full cost of the visit until you meet your deductible. Once you've met the deductible, then for an office visit to a Health First physician, you'd pay 40% of the allowed amount. The allowed amount is determined by Cigna. Pharmacy benefits for both the Gold and Silver plan are the same. We just mentioned that the pharmacy benefit for both plans is the same, and it's noted on this slide. Note that pharmacy coverage has separate out-of-pocket maximums from the medical plan. In addition to pharmacy benefits, when you enroll in a BPS medical plan, you gain free access to other programs and services, which cost you nothing extra. Hinge Health and Surgery Plus are two of those programs. Hinge Health is a virtual physical therapy program. Once enrolled, you'll receive the necessary equipment at no cost to you, so you can interact with coaches and physical therapists when and where you choose. Surgery Plus covers eligible, planned, non-emergency surgery at no cost to you, and access to the program is initiated by a call to one of their care advocates who will guide you through the process. Another program included with enrollment in a medical plan is virtual care from physicians within MD Live from Cigna. Once you create your account, you'll be able to access one of their many providers day or night as the need arises. Using MD Live from Cigna is again at no cost to you. Brevard Public Schools offers medical plan enrollees the opportunity to reduce their medical plan deductible by completing two wellness activities, an annual physical and a health assessment. You can have an annual physical performed for no cost either by an in-network Cigna provider or at one of the 3 BPS employee WellCare centers. More about the centers shortly. Health assessment is an online questionnaire completed at mycigna.com once you've created an account. As a new employee, completing these activities by the deadline noted in your new hire benefits package not only reduces your deductible in the year you're hired, but also in the following year. It's the only time that doing these activities once counts for 2 plan years. We've just talked about the activities that lead to a reduced deductible, so here we'll take just a few moments to review the 3 levels of medical plan deductibles. Everyone starts at the highest deductible, which is at the non-wellness level. Note the highlighted $5,000 under the Gold plan in-network, for example. From there, medical plan enrollees must earn their way to the lower deductibles of 1/2 wellness and wellness by completing the wellness activities. Non-wellness is if neither the employee nor the spouse completes both activities. 1/2 wellness is if only the employee or only the spouse completes both activities. And wellness is if the employee and spouse each complete both wellness activities. Earlier, we mentioned the BPS Employee WellCare Centers. Here's information about this great benefit. If you're enrolled in a BPS medical plan, you have access to our 3 WellCare centers in the north, central, and south parts of the county, as shown. Any service received or medication dispensed at a WellCare center is free for employees and their dependents older than 6 who are enrolled in the health plan. Service you can receive at a WellCare center includes health and wellness coaching, primary and acute care, chronic condition management, and annual physicals. Very important to note, the WellCare centers are not walk-in clinics, so just like doctor's offices, appointments must be made. However, same-day appointments may be available. As an added bonus, evening and Saturday hours are available at 2 of the centers. The BPS health plan also includes a tobacco use surcharge program. Use of any tobacco product is subject to the $50 per month surcharge. Such products include cigarettes, cigars, and pipes, and e-cigarettes. Employees enrolling for medical coverage must complete the online medical affidavit, which includes a question about their own tobacco use and that of their spouse, if applicable. Employees affirming tobacco use on the affidavit will be subject to that surcharge. Only one surcharge will apply even if both the employee and spouse use tobacco. However, both must complete the tobacco use cessation program by September 30th of 2024 in order to have applied surcharges refunded and further surcharges waived. The program consists of 6 coaching sessions and includes nicotine replacement therapy. Now that we've covered the medical portion of the BPS benefits program, let's look at other components. The BPS dental program offers 4 plans, 2 PPO plans and 2 HMO type plans. There's a high and low option under each. The high option has richer benefits and costs more, and the low plans have less benefits and cost less. Our vision plan benefits offer 2 plans, basic and enhanced. The basic plan has minimal benefits and costs less than the enhanced plan with richer benefits. The flexible spending account program offers 2 options, health care and dependent care. With the flexible spending account, pre-tax payroll deductions from your paychecks fund your account. Then, those funds can be used to pay for eligible expenses under the plans you choose. For health care, some examples of eligible expenses are office visit copays, eyeglasses, and prescription drugs. For dependent care, eligible expenses include child care costs or elder care costs. Life insurance is another component of the BPS benefits program. Every benefit-eligible employee at BPS receives one time their annual pay in basic life insurance paid for by the board. Even if you elect no other coverage, you'll have this benefit, so please be sure to name a beneficiary for this coverage. In addition to the free basic life which the board provides, you can also elect additional employee life, accidental death and dismemberment insurance, and dependent life insurance. Each of these is optional. BPS also offers short and long-term disability plans. The short-term disability benefit is 60% of covered weekly earnings for up to 26 weeks. The LTD benefit is 60% of monthly covered earnings. The maximum benefit period depends on your age at disability. Short and long-term disability are guaranteed issue to you as a new employee. This means you will be approved for coverage, no questions asked. If you decline this coverage as a new employee, you may elect it later during an open enrollment period, but at that point, you'll be subject to completing a health questionnaire and waiting for an approval or denial decision from the carrier. Now we'll talk about some programs which are available to all BPS employees, even if not eligible for benefits. We all have access to the Employee Assistance Program, or EAP, not only for ourselves, but for our family members too, including in-laws and out-of-state dependents. Using the EAP is free and is completely confidential. You can get up to 6 in-person visits with a licensed counselor or psychologist, and you get unlimited sessions by phone. In addition to counseling, the EAP offers a wealth of information and assistance for many issues, including finding child and elder care, summer camps, special needs services, and financial and legal concerns. Help is available 24/7 and is just a phone call away. Further, BPS is fortunate to have 2 Cigna on-site wellness professionals who collaborate with the district and the WellCare centers to offer all employees fun and beneficial wellness activities and challenges all year long. The activities include walking and weight loss challenges, lunch and learns, and yoga classes. And if fun wasn't enough, many of these events even offer prizes. Prime Benefits is the district's benefits administration system. It's not only where you'll enroll for benefits, but it's also the place where your personal benefits information will be kept, including your life insurance beneficiaries, which you can change yourself at any time. To access your Prime Benefits account, simply use your BPS login credentials at the screenshot shown at left above. The right side screenshot shows you the home screen in Prime Benefits from which you can access all your benefits information. This brings us to the end of the benefits presentation. This final slide provides contact information for several benefit resources. Make a note that each BPS school and worksite has an on-site benefits contact, which for schools is typically the school secretary. If your on-site benefit contact isn't available, feel free to contact the Employee Benefits Office at the number shown. Tell us where you work, and you'll be connected with the benefits team member assigned to your work location. You can also email us at the e-address shown. You'll also note additional resources available to help you get the most bang for your benefit buck.